Wonderful. Good afternoon, everyone. Thank you for getting on so promptly. Good afternoon. Welcome to the Assembly Committee on Health and Human Services. I will open the meeting for today. Members, again, please keep on your cameras so we know that we have a quorum and that everyone is present. And again, please mute your microphone when you're not speaking to minimize any background noise. Madam Secretary, please call the roll.
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orentlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus. Chair Wynn.
Here. If our members that are not present, if we can mark them present when they arrive, I will also try to keep an eye on them. I know that the agenda had said at the adjournment floor, and I know we were wondering if there might be some deadlines or it might take a little longer today. So I appreciate everyone's promptness here today. And I'd welcome our audience joining us on this virtual meeting. We have one bill hearing today, so I'm just going to jump right into it. Today we are going to be hearing Assembly Bill 44, and I will now open the hearing on Assembly Bill 44. This bill revises provisions related to county hospitals, and we have with us today Mr. Van Houweling, the CEO, and Ms. Pitts, General Counsel at University Medical Center, and I will turn it over to you all to begin when you are ready.
Good afternoon, Chairwoman Wynn and members of the committee. For the record, my name is Mason Van Houweling, and I have the honor of being the Chief Executive Officer of University Medical Center here in Las Vegas. As many of you are aware, UMC is one of the busiest hospitals in Southern Nevada, situated in the urban core, located right in the heart of the Las Vegas Medical District. The hospital serves as Southern Nevada's safety net for residents and visitors alike. UMC provides a number of services that are home and one of a kind here at UMC, including the Level 1 Trauma Center, the Lions Burn Care Center, the Center for Transplantation, Children's Hospital of Nevada at UMC, and a Level 2 Pediatric Trauma Center. UMC retains more than 4,000 employees and cares for hundreds of thousands of visitors and patients each year. In addition, UMC is affiliated with University of Nevada, Las Vegas School of Medicine, in the creation and pursuit of a premier academic health center. Over the last year, UMC has played an integral role in the states of Nevada's COVID-19 response. As being the state's leader in COVID-19 testing, we performed well over 1 million PCR tests with result turnaround times less than 12 hours. And now we've moved on to the next chapter in the COVID-19 vaccination efforts. And as of right now, we've done 41,400 vaccines today. We are here to discuss Assembly Bill 44, a bill that is sponsored by Clark County and supports the mission of UMC to provide the highest level of care to our patients, while ensuring exceptional quality and meeting our goal of being good taxpayer stewards of the taxpayer dollars. This bill serves for two purposes. First, it codifies in Nevada revised statutes our UMC governing board. The governing board was created by Clark County Ordinance in 2013. The governing board members are appointed by Clark County Commission, which remains as UMC's Hospital Board of Trustees and UMC's ultimate authority. In 2013, the commissioners had the foresight to recognize the importance of having dedicated members of the community with specialized knowledge and skill sets to provide oversight and guidance with respect to daily management hospital operations. As I know and members of this committee understand, healthcare law and regulations are very complex and always evolving. The second purpose of Assembly Bill 44 is meant to address the complex, unique issues a hospital faces in healthcare issues around regulatory environment. UMC would like the ability to have frank and open conversations and dialogue with our board leaders, whether it be with the governing board or the actual board of hospital trustees. In fact, our licensing and regulatory and accreditation standards require us to ensure both of our boards are fully informed when making very difficult decisions. Whether it's the ability to have these private deliberations under other Nevada law, those procedures and those statutes often can sometimes conflict. Furthermore, it can lead to delays in forming our board earlier than we would like. Whether proactive measures that can serve to improve the quality and care as we have discussed. To be clear, this bill does not allow for the governing board of any public hospital to take action or make decisions in a closed session. We have heard from various stakeholders since our bill was introduced. And throughout these discussions with our stakeholders, we've understood that the original language, perhaps, of the bill early on was a little too broad. It did not clearly address those narrow instances where closed sessions and deliberations are needed. The amendment before you today is narrowly tailored to meet our needs. Furthermore, we understand that the Nevada Rural Hospital Partners out there in the association and throughout the state are seeking to introduce an amendment that will extend these opportunities to rural county hospitals as well, so they can better address patient safety and quality concerns. We support our rural partners and their amendment, as we believe that this bill will ensure that public hospitals across Nevada will have the same ability as private hospitals to address federal and state regulations aimed at providing safe and quality patient care. This bill will also serve as a safeguard to the Nevada taxpayers, an investment in their own public hospital, by allowing a public hospital's governing board to proactively address any potential legal or regulatory issue, adverse outcomes, costly fines, or protracted litigation can be avoided. Again, this bill is not against transparency. UMC's governing board will always be transparent in its decision-making process. This merely addresses the ability to deliberate and have discussions with our board members. All votes on matters will occur in open session in accordance with all existing requirements. Finally, we do want to stress that we have been working with various stakeholders to address the concerns with this bill, and we will continue to do so. We are more than willing to listen and work with everyone to find a suitable compromise for a final bill. And with that, Chair Nguyen, I am open to any questions, and I'll turn it back over to you. Thank you for the opportunity.
Thank you for your presentation. And for our members, there are two amendments, and it's my understanding that both of those amendments that are on Nellis are friendly. Is that correct?
I'm sorry. Yes, they are correct. I was on mute as you requested, but yes.
And can I remind you to also state your name before you speak? Sorry.
Yes, Chair. Mason Van Houweling, for the record, CEO of UMC, and we are. That is correct.
And members, I did have committee staff email those out this morning, at least the rural hospital ones. I believe that one went out this morning, and they are both on Nellis that you can see under exhibits right now. Oh, excuse me. And let's see, what was I going to say? There are a couple of questions, a lot of questions actually. So I will go ahead and start with Assemblywoman Thomas.
Good afternoon, Chair, and thank you very much. And thank you for the presentation. I will not butcher your last name by addressing it. I do appreciate the presentation. I just have a couple of questions. One, does this mean that UMC becomes a private-public entity?
For the record, Mason Van Houweling, CEO of UMC. No, ma'am, that is not correct. We are always have been. In fact, we celebrated our 90 years of serving our community this year, and will continue for the next 90 years as a public institution operating for the Clark County community.
Thank you, sir. And Chair Nguyen, follow up, please.
Go ahead.
Yes, sir. With the way that I'm reading this, The Board of Hospital Trustees, which would be the county commissioners, would still be, as to say, the Board of Governors, hospital governors, bosses. Am I correct?
Yes, ma'am. For the record, Mason Van Howling, again, CEO of UMC. Correct. That is not changing. It is just codifying. Back in 2013, Clark County established UMC's governing board, and we've done really great things. And I can take you through all those highlights. But the hospital board of trustees, which are the Clark County commissioners, when they put their hat on, when it comes to hospital business, they are serving as hospital trustees. They have oversight of the UMC governing board, which are those community members. And we meet monthly, but also there's 4 subcommittees under that board: a finance committee, a quality committee, strategy committee, and HR. And those meet often throughout the month and serve as kind of the overall operating oversight of the hospital. But those governing board members report to the hospital trustees, which is our Clark County commissioners. Hopefully that answers the question. So nothing's changing there. It's just codifying it in Nevada revised statute, which is already in Clark County ordinance here.
Thank you. And Chair Nguyen, I actually have 2 more questions. Follow up, please.
That's okay. Go ahead and ask your question.
Thank you. So how does this affect the union?
Mason Van Howling, for the record, CEO of UMC. There is no direct impact or indirect impact to the union. As I mentioned, any deliberations or votes or decision-making always would come out in a public session. And we have great attendance at our meetings with the union. I meet with them frequently, our team meets with them frequently, but I can't see any direct or indirect impact to our union partners here at University Medical Center. I can't even come up with an example, but it's just not there. But they're always welcome to our meetings, and they do frequently attend the governing board meetings, the subcommittees, but also if there's any hospital trustees business matters that goes in front of Clark County commissioners, they're often there supporting or making their voice heard. But usually I'm there with them side by side.
Well, my concern was the fact that the governing board would be tasked to make bylaws, changes, and things of that nature, and I was wondering how that would affect the union over at UMC.
Yes, ma'am. Mason Van Howling, for the record. Again, those would always be handled at the county commission level. Again, with the hat of as a hospital trustee, and they're very good at switching over from Clark County Commission business to hospital business. And there would be no changes to bylaws that would come out of a closed session within UMC. And again, all those decisions, any votes are always done in the public eye, properly noticed, vetted out, and discussions made, but nothing that I would see that would directly impact the union with this particular bill.
All right, thank you, sir. And just one more question. In your presentation, you had mentioned, if I understood it and heard you correctly, you said that this AB 44 would prevent litigation. How is that possible?
No, I think so. It would certainly not prevent litigation. It would perhaps minimize protracted litigation, and I think that's the word. And I was probably reading too fast there, but it would allow us to inform our board much sooner of any potential regulatory litigation issues sooner than later. To be able to address those matters. But again, everything would properly be done throughout the process in an open decision. But I think it allow us to be a little bit more proactive on litigation matters and ultimately protecting our patients and our employees.
Thank you, sir. And thank you, Madam Chair.
Thank you, ma'am.
No problem. I think next we have a Question from Vice Chair Peters.
Thank you, Chair. And my question is kind of along the same lines. It's my understanding that there are already some protections for closed meeting discussions in certain cases and scenarios. Can you talk about those and the difference that this bill will make to those scenarios, and why this is particularly needed if we already have some protections for other specific scenarios?
Mason Van Houweling, for the record, CEO of UMC. Assemblywoman, I may lean on our general counsel a little bit on this one. There are instances when we can go into a closed session, whether it's particularly into litigation matters, but I prefer if our general counsel, Ms. Pitts, answer that question so I get you the exact answer you're looking for. So I'm going to step aside, and she's right here next to me.
Hello, I'm Susan Pitts, General Counsel of UMC, for the record. So yes, there are other areas and other statutes where you can go into closed session, for example, to talk about the competency and conduct of practitioners. There you would follow the procedure that would be under that statute. Here we're trying to put that ability under NRS 450, which is specific to running a hospital, so that we can follow our specific procedures related to that. The medical board has done similar in NRS 630, where they make references to this and following their procedure, as has state mental health and the Behavioral Health Commission statute under NRS 433. So hopefully that helps clarify.
So by running the hospital, can you give us a couple of examples of where this is important?
Sure. I think one of the big areas and long recognized and part of why we made the amendment to specifically reference review committees under NRS 49 is practitioners reviewing practitioners, peer review. So it's important when you're doing peer review in a hospital setting with physicians, for example, that it's the peers reviewing each other. The hearing, the witnesses, the testimony all get done with a panel of their peers. So it's in that setting where I see, us using this the most and being able to do that hearing and calling witnesses and testimony at the peer level. Then when it gets up to the governing board level, again, they're just really reviewing the record, not providing a whole new hearing.
And that practice right now, that peer review practice, is not, it doesn't have confidential components that are already protected under statute?
Yes, Susan Pitts, General Counsel of UMC, for the record. Yes, it absolutely does have confidential and privileged information. Again, that's in the review committee statute in NRS 49, but that isn't going to evolve at that level. It's not involving any public official or board member.
I guess I'm having a hard time tracking where this particular piece comes into play in the importance for the hospital. Could you try and narrow that down for me? Like, what is it that is missing right now that you guys don't have? And maybe I'm just not understanding, but I need a little more discussion than that.
Sure, Susan Pitts, for the record. So how it comes into play, again, using that example of peer review and practitioner review, it's long been recognized in Nevada law that to get physicians to participate in peer review, to look at the role of other physicians and instances where maybe, they didn't do the best or there was an adverse outcome. They review each other at that level. Again, it's at the hospital level. It's actually involving our medical staff, which is an independent entity, though it's under UMC. It's a group of physicians that are elected that meet and discuss these issues. What happens with all hospitals, frankly, is you have this peer review at the medical staff level and with a fair hearing panel of the peers. But the ultimate decision, according to healthcare laws and regulations, needs to be approved. So the medical staff or the fair hearing panel may make a recommendation, for example, that privileges are revoked. It has to go up in every instance with hospitals. It goes up to the board to approve that recommendation. Here, our board just happens to be a public board. So if the public board had questions about the record that might include that sensitive information that was at the peer review, they would be doing that in open meeting, or they would be going under 241, which again, while we have done that in the past and can continue to do that, it doesn't follow the same procedure we would like to do under NRS 450. So that's the missing piece we're looking to solve here.
Okay, thank you. That makes sense. So it is a very, very narrow place where this would affect how you're able to run like the review of issues within the hospital. I'm looking at your amendment, and it says the exempt from provisions to discuss matters, including without limitation, deliberation of the character, alleged misconduct, professional competence, and or physical or mental health of the provider or health of healthcare. So that's the scenario you're talking about, the peer review piece?
Correct.
Okay. And then the second is reports related to the compliance of the hospital with all laws, regulations, rulemakings, guidelines of the Centers for Medicare and Medicaid Services, or with any condition of participation in the Medicare or Medicaid program. Can you describe a scenario in which that is applicable?
Sure. So as a hospital, obviously we are licensed and accredited by a number of different bodies, both on the state and federal level. And to be CMS is who has oversight over the Medicare and Medicaid program. Obviously UMC, we take Medicare and Medicaid. And to be able to take Medicare and Medicaid, you have to follow certain rules of CMS and their conditions of participation. They expect, and part of those conditions of participation is that you have a fully informed board, that you are bringing any issues to them that, you know, you're policing yourself, much like in the peer review setting where physicians are tasked with policing themselves. In a hospital that is a CMS provider, you're expected to police yourself and then report those issues to a fully informed board. So that's what we're looking to address with that. And I understand, you know, that's where in this amendment, we tried to narrow that, and we will certainly continue to try and narrow that. But that's really what we're trying to accomplish.
Okay, I appreciate you entertaining the questions and talking about the specific scenarios. And I'm gonna pass on for other questions, but I may have more as we run through this. Thank you.
Sure, I'll turn it over to you.
Thank you. And next we'll go to Assemblywoman Benitez-Thompson.
Thank you so much. My question is still under section 1. I'm referring to the amendment now. So section 1 sub 5. So I want to make sure I'm reading this correctly. So as I read it, anything that any of the conversations and then the supporting records and transcripts for those closed meetings they're going to be outside of that 5-year rule in which it has to become public. So they will indefinitely remain not public records. Is that right?
Mason Van Houweling, CEO of UMC for the record. Correct, Assemblywoman. That those would become public after 5 years unless they're privileged and confidential. So you've read that correctly, and
I guess I worry about the need for this in our other statutes, even information that's held outside of public record, even some of the most sensitive records indeed do become public after, I think the rule is about 30 years or so. So could you talk about why you would need kind of a perpetual protection around this information?
I'm going to turn this one over to Susan because I know she's got the answer, but
Hello again, Susan Pitts, General Counsel of UMC, for the record. So what this does, it's actually because the 5 years was already in NRS 450 related to the other closed session that we have, we kept that for this. So it actually is saying that we will turn it over in that 5 year, or it would be open to public record after 5 years, unless it's privileged, which is how existing law is now. If it's privileged once, it's privileged for all time. So, but again, in instances where it's not privileged, like some of those issues I was speaking about with Assemblywoman Peters, CMS type issues, those wouldn't necessarily hold a privilege, and that would be subject to disclosure within 5 years or after 5 years.
I'm hearing two different things. I just want to make sure I have this straight, so I'm thinking of it right. So I see that you're keeping the 5 years in there for whenever you use chapter 49.117 or 49.265 in the regular way that you use it now. But the way I'm reading the bottom end is that if your board deems it to need to have that perpetual protection, then it will fall outside of that 5 years. So am I misunderstanding that, or is it really just 5 years for everything and I'm reading it backwards?
Susan Pitts, for the record. Yes, I believe it is meant to be, and we can certainly look if the language isn't clear on its face. It is meant to be that everything is subject to being open in 5 years unless it holds a privilege. And those review committees under NRS 49 would hold that privilege, but anything else would not necessarily hold that privilege. So it would be open. So we are not looking to keep that perpetually protected.
Okay. I guess the other piece that I still had some more questions on is I know that you're referencing and talking about some of the CMS conditions of participation. I guess for the legislative record, I would feel more comfortable if you could get to us what specific pieces of CMS data collection are you're concerned about. So much of that is aggregate data that I can't think of a time when you are really getting into protected health information at more of the aggregate level. Once you start collecting data, like you might have more of those conversations at a different level. But I think I need help with what you mean specifically. So whether it's Sentinel events and then kind of some examples of where you've run into problems with the data collection piece and satisfying CMS, and then the inability to provide information because of a sensitivity to public health records, because I think that would help it be more concrete for me and as I'm trying to understand this. I do have some additional questions in section 2, but Chair, I'm happy to kind of hold on to them and let the conversation continue.
I'll go ahead and go to, we have a bunch of people in line, so if it doesn't get answered, we can wrap back around to you, if that's okay, Assemblywoman Denise Thompson. Next, we'll go to Assemblywoman Titus.
Thank you, Madam Chair. I want to circle back to the line of questioning that Vice Chair Peters had, and I need a clarification and just first I'll make an observation. Having been on the State Board of Medical Examiners, having been on the State Peer Review Committee when that was in existence for the entire state, and having served as Chief of Staff for a hospital, I've been involved in lots of peer review cases, and they're not bad, they're not good, they're just something that has to happen for standard of care. And we, just for clarification, members, there's certain forms that charts get peer reviewed that fall into the category. If you transfer a patient out of the ER in 24 hours, if obviously someone dies in a certain stay, if somebody leaves AMA, all those are subject to peer review by standard. It doesn't mean that there's anything good or bad. It's just they fall into a category where you would review them, not necessarily because it's bad or not. And frequently I would look at those and just say, hey, that met standard of care, end of story. what I'm seeing in this bill is where the question is, I need clarification. This law already exists. NRS 450.140 exists currently. And what you're seeking to do, and you can say yes or no on this, because it already reads the Board of Trustees already has this ability. What you're adding here is language that, or any hospital governing board, because it's different between county hospitals, rural hospitals, and private hospitals. So is this basically adding a clarification on covering for all hospitals, not just those with a Board of Hospital Trustees?
Susan Pitts, General Counsel, UMC, for the record. So yes, I think the language you're reading from is really just a clarification that where a Board of Hospital Trustees can go into closed session, so can its appointed and delegated governing board. So that's just trying to make a clarification there at that language.
Right, and that's in section 1, number 3. And then the other ones, going to section 6, again, the Board of Trustees is already in that section 2, going down. And what we're adding here in counties, because many counties do not have hospital trustees, and counties with a Board of Hospital Trustees and where they're appointing a governing board, which is different structure, just clarifying that they may also have exercising powers and duties delegated to the governing board. So there's different ways of organizing hospital structure. The way I'm looking at this bill, it just clarifies that all of those levels of structure would then be included in being able to have that peer review to them under certain situations that's already afforded to in general language. Is that how I'm reading this?
Yes, Susan Pitts for the record. Absolutely. And I think if you look at the language in section 2 that talks about NRS 451.75, it states that in counties in which the Board of Hospital Trustees appoints a hospital governing board, the governing board is the governing body of the county hospital when exercising powers and duties delegated to the governing board pursuant to this chapter. So what that's saying is whoever is the delegated authority under whichever structure you are under, when they're taking action, they have the authority to take the action, because throughout NRS, it uses the term governing body. And so at times that can be confusing, whether or not you're talking about the Board of Hospital Trustees, the governing board, either one, whoever has the authority to take that action is the governing body for that matter.
Thank you for that, because the way I see this is actually clarifying language to statute that already exists under the many different conditions of hospitals that we have, to allow those of us who do peer review to do our job, which actually does indeed, as in the opening statements, will help for patients' overall outcomes and patient protection. So thank you for bringing the bill forward. Thank you, Madam Chair.
Thank you. I have a question actually before I go into it, because it kind of is in there. In the section, what does the privileged and confidential mean within the context of this statute? And is that the similar language that you're trying to capture that applies to other hospital facilities right now?
Again, Susan Pitts for the record. So in the amended language, we, in subsection C, we specifically called out NRS 49 because, the various stakeholders asked us to narrow the bill and get to what we were really trying to address. In NRS 49, those references, that is confidential and privileged conversations and materials that are used in those peer review settings. So hopefully that answers your question.
It does a little, but I also have another question. I mean, it appears to me that it's the actual board that gets to determine what's privileged. Am I reading that incorrectly, or is that kind of how the process takes place?
Again, Susan Pitts for the record. I do not believe the board determines what's privileged. If it's part of a review committee proceeding that fits under NRS 49, it is privileged, unless, of course, like any privilege, it's somehow waived.
I'm sorry, just one more question here. Under the current law, it doesn't allow for privileged information to avoid this disclosure after 5 years. Is that correct?
Yes, that is correct. Again, Susan Pitts for the record. what we're saying is we wanted to, because existing law in NRS had that 5-year requirement. If we went into closed session, it would, be available for somebody to request that information, the supporting materials. We wanted to make clear that that would apply here. But if something is privileged, it's still going to maintain that privilege. We didn't want it to be read as a waiver of any privilege after a certain period of time.
So if the board determines that it's privileged, then they can waive that 5 years.
The board determines that it's privileged. Well, no, I think it's, again, Susan puts for the record, I believe it was intended to be the opposite. But as we talked about earlier, if that needs to be clarified, we certainly could. The privilege is there. And after 5 years, anything that does not hold the privilege is subject to request for disclosure.
Okay, thank you. Yeah, I think I would also appreciate some more clarifying language on that area as well. And I think next up we have Assemblywoman Summers Armstrong.
Thank you, Chair Nguyen, and UMC for your presentation. So my concern is the change that you made in the language, and I just clicked off, so please bear with me while I go back to what I was reviewing. In the original language, that was crossed out in section, oh, I lost the document, I'm sorry. I had two things open and now I can't find it. In the original language, it talked about healthcare facilities, and it spoke specifically of peer review, and then you crossed that out. And so I'm like a little concerned about that because now it just says healthcare providers, which in my opinion seems broader. Providers of healthcare, which seems broader, but also, yeah, it seems very much so expansive and still not clear to me. So could you just sort of talk about who would be considered these providers of healthcare?
Sure, thank you for the question. Susan Pitts from UMC for the record. The statute specifically points to a defined term of healthcare provider, which is licensed providers. Our intent with that was to narrow it to those instances, again, of peer review of those practitioners. There was concern that we heard from various stakeholders that talking about the facility and some of the more general information maybe would catch up other areas of law, OSHA requirements and such for the facility. That's what we were looking to do. So the intent in that language was actually to narrow it to licensed professionals, licensed providers, peer review.
If I may, Chair Nguyen, follow up?
Go ahead.
Thank you. So when I'm looking at 49117, and it's talking about committees of the hospital, the ambulatory care, surgical center, and all that, peer would be the people that are working for those organizations that are providing the service. Is that correct? So that could include anybody who's working inside those facilities. Is that right?
Susan Pitts for the record. So what would be in the review committee could involve, I suppose, other people as part of staff? Is that, I want to make sure I'm understanding your question. Again, the review committee that the hospital is using in this instance is for its licensed professionals. And we can certainly, if your concern is that it not include something specifically, perhaps we could look at making it clear that it excludes certain things related to the facility. But the intent, again, is we use the review committee privilege for our peer review of licensed professionals. So that's why the reference is there.
Okay, thank you for that. I am concerned though, and I think I'm just to highlight my concern as well for some of the things that were mentioned before. the committee deciding what things are privileged is a concern of mine. I'm also concerned about a statement you made earlier about policing yourselves and the need for this to be confidential in some manner. I have a concern about that. I think often that hasn't worked for the general public when information is not available to the general public, to at least know that there could be issues in a particular area of government, because this is all being paid for by taxpayer dollars. And so this, UMC, although it is providing service, it's still part of the community. We own it because we pay taxes and we contribute in our communities for that hospital to run, not fully, but we have a stake in what happens at UMC. And so self-policing is very concerning to me, and especially when we talk about the people who are on these committees are already public servants, so they're elected officials. And I think that there is an expectation that some of what goes on would already be open to the community. And I'm just kind of concerned about adding another layer of what could be perceived as secrecy to a review panel, and especially when you already have a tool to protect people's identity. I'm just really confused about. I can't get clarity on the necessity for this additional ability to meet in secret. And so I appreciate it. If you have other information that you could share, I'd appreciate that very much to help clarify for me. I'm new at this. This is my first time hearing anything about UMC and how you all want to do this. And so I would appreciate it. Thank you.
Sure. And if I may, Susan Pitts for the record, just to clarify, when I use the term self-policing, that's the term really CMS, and CMS requirements. They require all hospitals, public or private, to engage in those types of activities. So that was what I was referring to when I said that. So thank you very much for your comment.
And I'm looking around. Do I have any other questions here from committee members? Doesn't look like it. So at this time, I will go to broadcast services and we will start testimony in support, opposition, and neutral of Assembly Bill 44. I'd remind callers to please clearly state and spell your name and limit your testimony to 2 minutes. Staff will be timing each speaker to ensure everyone is given a fair opportunity to speak. And with that, we will begin testimony in support of Assembly Bill 44. Broadcast services, can we have our first caller in the queue?
To testify in support of Assembly Bill 44, please press *9 now to take your place in the queue. Chair, we have no callers in support at this time.
Broadcast services, can we next go to callers? Oh,
I'm sorry, Chair, there's one person has raised their hand.
you know what? I see someone on the Zoom. I'm sorry, Ms. Hall. Go ahead and please state your name and provide your testimony in support.
Thank you. Joan Hall, JOANHALL, President of Nevada Rural Hospital Partners. Thank you, Chair Wynn, for allowing me this friendly amendment. I don't know if you want to go over that now or if you just want my support for this bill.
At this time, if you could just, we're doing support testimony, so if you could just do support testimony, I know the members have had the opportunity to review that.
Thank you. So NRHP is a consortium of 13 critical access hospitals, 7 of which are county district hospitals, all in support of this process. The National Quality Improvement Act of 1987 laid out the foundation for peer review all those years ago, recognizing that physicians were the best reviewer of physicians. And so that's why they put this process in place. They also recognized that doing this confidentially and in a safe manner was very important. So nationally, that standard has already been set. We appreciate this verbiage going into Chapter 450. It already is in law in Chapter 49, but putting it in 450 makes it, I think, clearer for both the district hospitals and the county hospitals and the public we serve. So we're very much in support of this. Thank you very much.
Thank you for your testimony and support. I am looking here to make sure there isn't anyone else on the Zoom in support, and it doesn't appear there is. So Broadcast Services, if we can next go to our callers in opposition of Assembly Bill 44.
I'm sorry, Chair, we actually had somebody raise their hand in support. Can I go to them now?
Yes, that would be fine.
Okay. With the caller with the last three digits, 461, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hugh Qualls, Hughqualls, Administrator, Mount Grant General Hospital in Hawthorne. I'd like to express my support for AB 44 and just echo what Ms. Hall from NRHP expressed, but just add a rural, but in Mount Grant's case, a frontier concern. And there are two major issues that I wish the Assembly to be aware of. One, and I believe Ms. Hall was referencing that, but in any hospital, but especially a small one like ours, that level of candor from peer-to-peer that exists in peer review is critical to getting specific information about any provider care that didn't meet the standard of care, if you will. And if that were to be public or disclosed to the public, I don't see that, at least in my experience, you'd have much candor or specificity that is required for continuous improvement, so that, once again, we're all concerned on patient outcomes. And if we can't have those candid conversations, it's going to be difficult to have the improvements necessary to provide the best care possible for our patients. Second issue, in a small town, a very small town like Hawthorne, it doesn't take much for people to put two and two together. So if this became public knowledge or was disclosed, no matter what level of discretion we exercised, people will soon know that, oh, that was my grandmother, the patient they're talking about, and we know who the provider was as well. It doesn't take much to, like I said, to connect the dots. So that is a concern, and once again, my recommendation for keeping this as private as possible in order to improve the quality of care and to provide some PHI protection for our patients. Thank you.
Thank you. Broadcast Services, do we have any other callers that are now in support on the line?
Chair, that was our only caller in support.
Thank you. If we can go next to our callers in opposition of Assembly Bill 44.
To testify in opposition of Assembly Bill 44, please press star 9 now to take your place in the queue. With the caller with the last three digits, 807, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, I'm hoping that I got, what was the number that you mentioned?
We're doing Assembly Bill 44, and we're taking opposition testimony, sir.
Yeah, okay. I just wanted to make sure that they called my phone number because I missed that. But in any case, as long as I'm here, thank you, Chairman McGuane and members of the committee. My name is Richard Carpel. I'm the Executive Director of the Nevada Press Association. And I'm also testifying today on behalf of the Nevada Open Government Coalition. We oppose the sections of Assembly Bill 44 that close meetings and make public records confidential. And we don't think the amendment that was submitted on Friday helps. Now, let me start by saying my understanding is that there are other members of our coalition who are in communication with the bill proponents and that we will be meeting with them to work through our issues. So we're certainly open to learning more. But based on what we already know, it's not clear why any of this stuff, either frankly in AB 44 or even the stuff that's already closed in the underlying statute, it's not clear why any of it needs to be secret. So for instance, why shouldn't residents of the state be allowed to participate in meetings where the compliance of their local public hospital with federal laws is going to be discussed? What could possibly be more important to the public than whether their local hospital is complying with federal law? Let me also mention, if I'm understanding the peer reviews correctly, they should already be covered by the open meeting law, which does allow public bodies to discuss personnel matters in closed section. And let me conclude by mentioning that the proponents appear to be conflating privileged and confidential information. They're actually two different things. So with that, I will end and just again say we are opposed to Assembly Bill 44. Thank you for letting me testify.
Thank you, Mr. Carpel. If we can go to our next caller in opposition of Assembly Bill 44.
Would the caller with the last three digits 900 please slowly state and spell your name for the record? You have 2 minutes and may begin.
Good afternoon. My name is Justin Watkins, Watkins. Thank you, Chair Wynn and members of the committee. On behalf of Nevada Justice Association, I'm a non-paid lobbyist, and we are opposed to AB 44. Simply stated, the intent that is stated in this hearing does not mesh with the language of the bill, nor do the policies align with the language of the bill. For a little context, the reason why peer review committees and their deliberations are not disclosed for 5 years is so that there can be honesty amongst peers and not retribution amongst peers and have an honest review. That policy does not comport with the bosses of the company or the hospital reviewing the conduct of its employees. So there can be no fear of reprisal from the employees against the governing body, and therefore there's no need to have secrecy or lack of transparency in this regard. Further, the stated timelines of the secrecy, the 5 years, now get extended indefinitely under the language of this bill if the committee determines that that information is privileged. Existing law, it must be disclosed after 5 years. Now, no disclosure would be had. What this means is that people who have been wronged by the hospital will be unlikely to find out any relevant information to why they were wronged, who is responsible for the wrong, as the 5 years far exceeds the statute of limitations for bringing a claim. And the people of the state of Nevada will not be able to hold their elected officials accountable for being good or bad stewards of their tax dollars and administering the governance of the hospital. And for those reasons, there's a lack of accountability in this bill. There's a lack of need for this language in its entirety, and it certainly is against public policy to increase the level of secrecy amongst government-funded hospitals. Thank you.
Thank you for providing your testimony in opposition, and welcome back to the Assembly. If we could go to our next caller in opposition of Assembly Bill 44.
Chair, there are no more callers in opposition at this time.
And do we have any callers in neutral on Assembly Bill 44?
To testify in neutral on Assembly Bill 44, please press *9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
And do we have any callers on the Zoom in neutral on Assembly Bill 44? I saw someone registered, so I wasn't sure. I'm looking here. Don't see anyone raising their hands or lighting up.
Chair, you are muted.
Sorry about that. Do we have any callers on the line on Zoom in neutral? Seeing none, I will go ahead and turn this back over to Mr. Howling to make any closing remarks.
Well, thank you, Chair, and members of the committee for your time today and hearing the bill. And as Ms. Pitts, we're constantly listening. We want to continue to work and to refine the bill as needed. And I think that's been the way we've operated for not only this legislative session, but the previous ones as well. So again, we'll be reaching out to those that had additional questions. And again, I think just underscoring two things, codifying the board in NRS is important to our Clark County, and then also just narrowing down the bill to make sure that we're able to have discussions and dialogue, but always we'll do things in open session. Any actions or any votes will always be done in open session. So again, I appreciate the members' time today, and we'll be reaching out to those that have further questions.
And you know what, actually, before I let you go and before I close this hearing, I did have a couple of follow-up questions. I know that previously Assemblywoman Benitez Thompson had some questions about Section 2, and I don't believe that they were answered by some of the other questions. So actually, if I can bring her back on to ask the follow-up question regarding Section 2, that would be great.
Thank you so much. I just wanted to make sure, because I think Section 2 is probably much more the meat and potatoes of what you're trying to get at. And obviously you've got this bill here. The counties don't get very many bills, so this must be a piece that's important. So I don't know what the distinction would be between the practice right now where you've got a governing board, or UMC has a governing board, and the powers and duties that it's using without it being specifically stated, I guess, in statute, or that someone has given the opinion that it is not specifically stated in statute, and then putting the provisions of Section 2 into place. So I guess the end would be like, how would things change from how they are operating today to how they would operate after the effective date of this bill?
Mason Van Howling for the record. Thank you, Assemblywoman. Yeah, I think it's just really just clarifying, again, since 2013, this has been in Clark County ordinance. As you heard, reference to NRS 450, just codifying that and clarifying whether it's a governing board, governing body, just the authority that would clarify in Section 2. So again, hospital trustees here at Clark County are elected officials. They appoint governing board members to oversee the governing board, but also the subcommittees. But I think, as Ms. Hall had mentioned, this would help other district hospitals, other public hospitals, just clarifying the language on the authority and putting it in the right section in Nevada Revised Statutes 450.
I appreciate that. So there's nothing else I need to hold in my head to give consideration to this. It's literally, as you guys see, Section 2, just to clean up. There's not other conversations going on. That I'm from, Northern Nevada. I'm not in Clark County, so I don't know if there's some other consideration I should be holding in my head.
No, Mason Van Howling for the record. No, I think as you stated, it's just kind of the meat and potatoes. It's an important piece, but it's just codifying it and bringing clarity. But no other intents around that. Just make it more in NRS 450, which kind of defines all the hospitals here in the state, as previously mentioned.
All right, and then just real quick, because tying back to Section 1 in the amended version, the sub 3, you do have the word any in here. So it says the Board of Hospital Trustees or any hospital governing board, but really the intent is just the hospital governing board. You can't imagine a scenario in which there would be multiple governing boards. You mean it as the one and only appointed governing board that would hold that authority. There's not a plan for additional governing boards to hold additional authorities.
Mason Van Howling for the record. Yes, ma'am, you're correct. There's no other intent, certainly not here in Southern Nevada, and not speaking for Ms. Hall, but because structure could be different in a district hospital versus a public hospital, county hospital, but no other intent there. It's you've got the trustees and the governing board here, and that's how we see it for the long future ahead.
Thank you, Assemblywoman Benitez Thompson. I'm sorry I skipped over you, wrapping back around. Is there anyone that has any follow-up questions based on that line of questioning? It doesn't appear to. So at this time, I will close the hearing on Assembly Bill 44. Thank you for your presentation. And yes, at this time, we will move into public comment. As a reminder, to provide public comment, you have to register online at the legislative website. Again, please remember to clearly state and spell your name for the record and limit your comments to 2 minutes. We will be timing to ensure everyone is given the equal opportunity to speak. Broadcast Services, do we have any callers on the line for public comment?
Participate in public comment. Please press star 9 now to take your place in the queue. Chair, there is nobody on the line for public comment at this time.
Wonderful. At this time, I will close public comment. Are there any other comments from committee members before we adjourn today? Seeing none, I will adjourn this meeting. Our next meeting will be on Wednesday, March 24th. Thank you, everyone.